This is the lower right first and second molars. From the x-rays, it's very difficult to see if there's any decay there. We used a laser, and the laser told us that there was some sort of a problem. There was also an old composite that had leaked, and we went ahead and saw a sealant as well. So we're going to remove the sealant and the composite and then come back and see the buccal aspects of the teeth, which is right here. They look perfectly clean, just a developmental groove. But the actual, this is by way of a popcorn kernel, but the actual teeth with the laser right in that area where the little brown spot is says that there's decay. Now this is a spot that often is missed by a dentist until it gets to be fairly large. Now we go ahead and remove the actual composite. You see the decay that's underneath there, and it's fairly deep. That particular burr is about 2 millimeters deep. And we're wondering if there's a fracture line that goes all the way through the tooth. But in the process of cleaning it up, we see that it isn't on the floor of the tooth, and so just a regular filling is needed. Using a mirror so that I can be sure that I can get everything out. And that ability to use a mirror will come in very handy when, and this is the micro etcher, it's aluminum oxide that goes in, and when we take a look at the tooth, you can see that the floor that there's no fracture line, so a regular filling is great. And then we're removing the sealant and seeing what's underneath the sealant, and yes, indeed, when we get a look at that, we'll see that there's decay. And here is the buccal aspect that I was talking about before. It doesn't look like very much. We go ahead and do it for both first and second molar. And we'll come back and use a mirror to evaluate everything and see if it needs to be done. Because from this angle, the dentist can't actually see very well. And as we look at the tooth in the mirror just that second ago, you can see how it's a little bit discolored, not very much at all on the second molar. So here's the first molar, and we'll go in, and we're using a mirror so that we can see exactly what we're looking at, as opposed to if you look off to the upper right, you can see the actual drill, but you can't see the back of the filling. So even in this area, it looks not so bad, but as we're drilling a little bit, the black space gets bigger, and then it gets bigger. And we're using the mirror so that we can see everything. And there's the x-ray again. Really don't see very much on that first molar or the second. But there's the decay. And it's getting larger and larger. And so having a mirror view of this tooth helps in removing it. Because as you can see, if I was just looking from the angle on the upper right, I wouldn't know if all the tooth decay was removed. And so we'll go ahead and evaluate that for decay. And here's the second molar. You look at that and it's like, wow, that doesn't look so bad. But because the laser showed that there was decay on the other one and it was pretty significant, we're opening up that little groove a little bit, and the laser had said that there was something going on in this tooth as well. This particular laser was made by Cavo, the Diagnodent. You see that little black spot there? And it's really very tiny, and it's a simple thing to get right now. and make a small filling that will probably last the person 20, maybe 30 years, possibly longer, because there's really no occlusion going on. But if left to itself, it could grow and grow, like the filling in front of it. And we're using the mirror on that second molar so that we can actually see. It's very helpful. This is at 9x magnification to be able to see that. So we place the fillings and go back and polish everything so that it's nice and smooth. And a smooth filling doesn't allow plaque to get on it quite as readily, and they last longer. I use a 2-system polishing system like this. In this case, these are polishing discs from Cosmodent in Chicago. So there's the fillings. They look good up on top and then also on the sides.